Hello guys, and welcome back to a brand new video here on Two Ordinary Guys. Like you guys know, I upload every Monday and Friday. So today was supposed to be the Friday video, but it's going up on Saturday, so apologies for that. I know I've already mentioned kind of briefly what area of nursing I'm interested in, but I kind of wanted to sit down and talk about properly, make a video out of this, because I wanted to talk about my exposure in nursing. What have I seen already? I'm starting nursing in September, so I've got seven months to go. What kind of areas have I seen in my past, and why has this enabled me to be interested in such and such? Basically, what I've experienced beforehand going to university with paramedic science and all the rest of that, and why has it enabled me to pursue my interest in nursing for one, but also why has it enabled me to choose the area of interest in specialty. So quickly, I know the people that watch my channel all the time kind of know what my channel is all about, so if you're watching this and kind of already know, just skip. Quickly, I'm documenting my journey to become a qualified nurse. Basically, I start university in September. If you kind of want to know the backstory, then go and watch my videos beforehand. I don't really want to mention too much on this video, but they'll kind of give you, the backstory. So stick around until September. I'm going to be doing videos like this, talking about why I wanted to be a nurse, and kind of just be documenting my journey as I go along. And I'm applying for bank work for the NHS, so I'm kind of taking you on this journey with me. So I would really appreciate it if you can subscribe and like down below. I'd really appreciate that. So let's get into it. Quickly, one last thing, follow me on social media. My links are in the description below. Now, let's go. So I think I should start this video by saying what exposure have I've been exposed to. So what have I been exposed to beforehand going into university? So I knew that, well, I thought I knew I wanted to go into paramedic science. I wanted to be a paramedic from very young. I grew up not really being very academically strong. As you guys know, I've been documenting my journey for a very long time. So I then looked into being a paramedic, and I realised that you had to have some sort of experience working in care. So I applied and went into my local care home. They didn't really have much going, but I kind of helped out with, with the breakfast and stuff like that, and just volunteered there really because I was too young. I think you had to be 18 to actually get a job there. In the meantime, I then started communicating with the residents and really started to get a bond with the patients. I missed going in. I was thinking about it all the time. I'd be thinking about residents. I'd get really upset if any of them passed away, and I kind of had my heart set on this place. I really enjoyed going in, completely unpaid, but I just had this passion to. It all started off by trying to gain experience, but I kind of this love for nursing then started from me going out my way and just kind of getting experience, and I feel as though that's kind of what life is all about. You're always trying to get more experience and learning new things, and sometimes you'll just stumble across something that you actually really enjoy. And I'm going to kind of mention that in a little while. I'm going to go in more detail about that. So I started to volunteer at my local care home, and on my 18th birthday, the manager pulled me into the office and said, we've been monitoring you for a long time. You have what it takes to work here. Would you want the job? And I was just like, absolutely yes. So I then worked my way up at the care home. I worked my way up to doing the medication and stuff like that, and I really enjoyed working there. And honestly, when I do go back from university, I go and pop my head in. I've got residents that I still keep in contact. I call them, I call the care home and wish them a happy birthday. I still remember their birthdays. That's how much I really enjoyed the placement. That's how much I really enjoyed my job, and it was kind of more of a job to me. When I used to go home, I used to be thinking, well, if I wasn't in for a couple of days, I would then have to call up the care home to say, how so and so doing. So that's kind of where I got my area of. For the first time, I thought, do I really want to go into paramedic science, or do I want to be a nurse? And as you guys know on my other videos, like I said, I chose paramedic science because at the time I was more interested in emergency medicine, pre-hospital care. But then I then volunteered in another hospital. I'm helping out with, meal times and stuff like that, helping out serve the drinks and teas and coffees, all voluntary, all unpaid for. And I really enjoyed that. I used to work on many wards. I was exposed to many things that I would have probably never have seen if I didn't volunteer there. So it was really beneficial. And I did that for about 2 or 3 months, and then it kind of just died down in the end, I think, because I then started full-time at my care home. Obviously then when I started paramedic science, I then went on to placements and stuff like that. So we went on patient transport, you went into people's housing and spoken to them, and that was kind of a big deal for me. I've never been into someone's house. I know that the care home is their home, for example, but I've never been in a service, for example, that go into the house and kind of treat them with respect. And I really enjoyed the patient care side of patient transport. I really enjoyed that. And obviously then I went on to a ward. It was kind of like an assessment ward at my local hospital, and I really enjoyed that. Very different experiences to what I've been having post university. So it was really interesting to kind of see the hospital side and then patient transport. And then obviously after my patient transport, I then went into responding to emergency calls. Now, for the duration of time while I was on placement for paramedic science, I then started to, I wouldn't say fall out of love, I just kind of realised that I didn't want to be a paramedic anymore. I missed, lying in bed and thinking, I wonder how so-and-so's doing, or I'm going to give them a call to wish them a happy birthday. When I went onto shift, I didn't really know who I was working with. And I know in a hospital setting, you probably will never do that anyway, but it was kind of like, because I was a student, I was just working with random people, and there's not a problem. But then I missed having that familiarity of the patients. I missed having that bond and rapport of meeting the same people over and over again. So it really made me think, and that's kind of when I made the video then with you guys and told you that how I felt and I'm transferring to nursing. It was a massive moment for me, and will be and prove to be for the rest of my life. So I wanted to make this video because in a year and a bit time, when I probably at the end of first year, I'm going to make another video and kind of talk about my interests and what area of specialty I want to go into. It's kind of the same video as what I'm recording now, but in a year's time. Because like I've just mentioned just before this, your interests change based on exposure. So I could go on to oncology and really enjoy oncology, or I might go on to a palliative care placement and really enjoy that. It just really depends on what you kind of feel at the time, if that makes sense. So I feel as I wanted to record a video before going into nursing and then kind of a video after going into nursing, if that makes sense. So based on my exposure so far, these are the areas of nursing that I'm looking to go into and specialise in it. So first of all, the area kind of more appealing to me at the moment is end of life or palliative care nursing, as people know it as. I've been exposed to palliative care for quite a lot of times. My grandma was under the care of the palliative care team, so I spent 10 days with her when she was in a dying days basically, and the team and there's so many experiences when I was there, that just the care that I received was just absolutely amazing. And I feel as though we go back to exposure and what you've dealt with, the memories that I have from the palliative care nursing team were just absolutely amazing. If I close my eyes, like I've mentioned beforehand, I can see the nurse that was treating my grandma. I've always aspired to be like that as a nurse, and since that moment it's stuck in my head, and I would love to be remembered like that. Also, during my time at the care home that I worked at, there were many patients there that were on palliative care, and I have been part of that pathway for them. And even if it's just listening to their favourite music, there was a patient, they wanted John Travolta while they slipped away, and I feel as though that's very special. You then have the duty of care for that patient's family members, and I feel as though, for me, I wanted to be a palliative care nurse for quite a long time now. Kind of when my grandma was poorly, but when I worked at the care home, I've always kind of aspired to that. It's kind of always been, you know, in my head, and that, you know, it's such an amazing job, and you need to have a lot of courage to do it. You know, you are going to see some quite upsetting things, and that's what I'm talking about with exposure. If I'm then working with this if I'm like on a placement, I might not enjoy it as much as I did beforehand, you know, when I'm surrounded by all of this. But I feel as though before I came to university, my granddad was quite poorly, and he was technically on palliative care as well. And although it was my granddad, you kind of cherish the moments that you have with your loved ones in your dying times, and that's the kind of nursing that I like, to build up the bond. Where sometimes it's just holding their hand and saying that, you know, although you can't say everything's going to be okay, you can just do your very best with that patient, and that's kind of what I love about nursing as a whole. So it's more about when my grandma was poorly. She had cancer, bowel cancer, and like I said, the nurses there were just second to none, and I've always just aspired to be like those nurses. So that's one of the areas of nursing that I would be looking at the start of nursing. My next specialty that I'm interested in would be the community. So like I mentioned with PTS, I enjoyed going to people's homes. I enjoy having the same people. I enjoy having the bond that you have with the patients, and that's kind of, you know, different to what I was talking about with palliative care. You know, it's a fast turnover rate, unfortunately, with palliative care. You know, you might have someone that's been in there 3 months, or you might have someone that's come in for, you know, 6 hours, and you just don't know in that situation, and that's, you know, that's kind of where it's like weighing up what you want to have as your interest and your specialty. But I feel as though community is a big thing that I would like to go into, and it's something I'm really considering, and I can't wait to start nursing so I can go on these placements and have these, you know, my thoughts kind of answered for me, if that makes sense, and the questions that what more am I interested in. I feel as though when you actually go on placement, you'll kind of know, and you'll kind of have that click in your head. With the patient transport and the ambulance service, I enjoyed going to people's homes and, you know, treating them with respect, but I didn't have that, you know, you had that sort of time frame. You had to get to know them, and then you'll never ever see them again. And I feel as though with community, you sometimes go out to people, you know, once every week, once every couple of days, and that's what I miss about my job. And I would never go into a job if I don't enjoy it, and that's kind of where my decision led beforehand, is I will never go into a job that I don't enjoy, and I'll always be honest with myself. So community for me is a massive, you know, interest of mine, and I just can't wait to start, like I mentioned. As much as palliative care, so I've got palliative care here, community here, I feel as though in the middle is working with the elderly. I have had a lot of experience working with the elderly, but beforehand in my previous, you know, exposure that I've talked about. But for me, that is where my interest lies. Talking to them and getting to know their stories. I honestly think they're amazing. Some of the stories that you can just sit and listen to. If you've never asked, you know, an elderly, you know, relative or a patient of yours, you know, about their life, then I recommend doing so. When you have like a 20-30 minutes spare, just ask them about their life, because some of the stories that they've got will stick with me for so long. I can recall so many stories to people. I'm obviously not going to tell onto the camera, but you know, I tell Lucy some of the stories, and they're absolutely amazing. Like I mentioned, there is an area that I want to go into. I want to specialise in an area. That's kind of the nurse I want to be. You know, specialise in a certain topic. It might be cardiology or respiratory. Like, I want to specialise in something. So a big thing for me as well would be mentoring. So I want to mentor students or become a mentor. When I was a student at Worcester, when I qualified to be a qualified paramedic, I wanted to work with the students to become a clinical team mentor. This is something that I'm interested in when I'm a qualified nurse. A quick recap. An area for me specialty, and this is just something that I've been exposed to, or something that I feel as though I might be, you know, looking to go into. But when I do start, this could change, and that's why I'm recording a part 2 to this video next year after my first year. Palliative care, community, working with the elderly. Last but not least, with my nursing degree, and when I do qualify, as I mentioned with all the other stuff, they're just my ideas of an area of specialty that I would like to go into. I would love to speak in front of, you know, people representing the RCN. I want to promote, you know, patient care, you know, all them, you know, the area of nursing. I would love to promote and speak in front of, you know, people. It's always been something that I've wanted to do, so that's kind of my goal in the future. When I do qualify, is to take my degree a little bit further, and maybe in years to come I could be speaking in front of people. So that's kind of something I'm working towards, kind of behind closed doors, eventually taking little steps. So yes, I would really appreciate it if you could drop down in the comments what area of nursing / specialty you guys wanted to go into before you started university, and then how it's changed over the time of university. I'd really appreciate that. I think it's really interesting. Of course, my interest might not be right. I might not want to go into palliative care nursing at the end of it, or community or something else. I might fall in love with another area, and that's kind of the beauty of nursing. I feel you never know what you're going to fall in love with. So there we have it. I hope you've enjoyed this video. Make sure you like and subscribe down below, and I will catch you guys on Monday for my next video. I'll see you then. Bye bye.